Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Welcome to the Stem Cell Healing Institute podcast. We are here with Dr. Zahra Figueredo doing part 2 of FAQs, frequently asked questions. And if you missed the first episode, please go back one episode because that's part 1 and this is part 2 of this podcast. How are you, doctor?
I'm very well, Luis. Thank you so much. How are you today on this beautiful day?
I'm doing excellent.
Great.
Doctor, we did a bunch of questions on the previous podcast, but we're going to continue with the frequently asked questions that most of your patients ask you. It seems like you prefer to use bone marrow stem cells than fat and umbilical cord stem cells. Is that correct?
Yes, we actually use all three,
Okay.
as well as endometrial derived stem cells accordingly, and I can get into the specifications on that. But the reason why we tend to sort of gear towards the bone marrow derived stem cells is because we have devised a proprietary method of growing and producing brand new stem cells right in the bone marrow. We say in vivo, without incubating outside of the body, so minimizing any risks of contamination and other risks that can go along with that. And we can get unprecedented numbers of brand new, non-toxic, young, very potent stem cells for one treatment session. And where we can combine different treatments, like we mentioned in the first podcast of this series, we can combine several different treatments or conditions into one treatment because we have such high numbers of stem cells. But also, it's really important that not only are the numbers important, but the viability. So in a lot of cases, we can have hundreds of millions of stem cells, but if they're not alive and active and actually potent and workable, then there's no point. So it's really important, the viability, the numbers, the potency, the non-toxicity, and all those really important factors. So we do opt for autologous in most cases, and then and also in most cases we'll combine with endometrial and or fat and or umbilical cord. And the reason why we do that with umbilical cord, with endometrial especially, is because they have an inherent capacity for further anti-inflammatory properties as well as very, very effective for autoimmune conditions. So in every case of autoimmune disease, we will always combine stem cells with the endometrial.
Okay, and there is one kind of stem cells that we do not use, right, doctor?
That's right. We don't use embryonic stem cells. We don't at all. That's really important to point out. I think a lot of patients, there's a misconception about cancers with stem cells, and embryonic stem cells are the ones that can be teratogenic, which means they can cause cancer. It's usually very rare, but it happens and it can happen. And for that reason, and of course other ethical reasons, and we don't use embryonic stem cells whatsoever.
So the misconception about stem cells provoking cancer, it's only with this kind of stem cells.
With embryonic, that's right.
Okay.
Adult mesenchymal stem cells, the ones that we use at the Stem Cell Healing Institute, they have there's no known cancer-causing properties with adult mesenchymal stem cells. So we are very safe and effective with our treatments with adult mesenchymal stem cells, because what happens is, technically speaking, adult stem cells are adults. They will die shortly after regenerating. And when I say shortly, that could mean a year, 2 years, maybe even 3 years, depending on the person, depending on the condition. With embryonic stem cells, they can regenerate and grow uncontrollably. because they are such a young, primitive cell line, they're not adult. So they can continue to grow and regenerate and possibly grow into uncontrolled growths and tumors, teratogens, as I mentioned. And so that's the fear with embryonic versus adult mesenchymal stem cells. With adult mesenchymal stem cell, again, there's no known cause of cancer with those types of stem cells.
That's very clear, doctor. Thank you for that answer. How long does it take to see improvements or to feel improvements after a session of stem cells?
Yes, we have had literally changes within days, to weeks, to months. Again, depending on the condition, depending on the degree of debilitation, age, medications, the condition being treated, the method of deployment, so many factors that can play a role. The general rule of thumb that we go by is 3 months, giving it a minimum of 3 to 6 months to see some sort of substantial results and substantial change in your condition.
So, since you mentioned the method of employment, what are those methods?
Yes. So we have several methods of deployment, and we will use more than one in most cases. So we will do intravenous infusion of stem cells with or without mannitol. The mannitol it's a natural sugar, and that allows for the stem cells to penetrate the parenchymal cells of the blood-brain barrier. Normally, these parenchymal cells are very tightly bound, and it's sort of a defense mechanism for the body to prevent any noxious chemicals or toxins to enter the central nervous system. But in this case, we want the stem cells, in many cases with neurological conditions, being primarily why we would use the mannitol. But what happens is the mannitol shrinks the parenchymal cells temporarily and opens up that gap junction between the cells, allowing the stem cells to get through. And again, very temporary. It's like a half-hour window. So we'll use an intravenous infusion of stem cells, sometimes mostly with mannitol. We will use intranasal aspiration of the stem cells, which is like a nose spray of stem cells that allows the stem cells to penetrate the circulation of the turbinates and the cribriform plate to again bypass the blood-brain barrier, going directly to the central nervous system. And then we may do an intrathecal infusion, which is an injection right into the cerebrospinal fluid in the spinal canal. That again is very often and commonly used for neurological conditions such as Parkinson's, Alzheimer's, autism, various multiple sclerosis, various different neurological conditions. And then finally, but not least, local injections. And that can take the form of joint injections, joint tendons, ligaments, skin, hair. So eyes, like retrobulbar injections behind the eyes. So that's what we mean when we say local injections. And so very often we will do more than one type of deployment in one treatment.
I see, doctor. And have you ever had a patient that rejected these stem cells?
Louise, you tend to ask the best questions. In the case of bone marrow, adipose-derived, umbilical cord, endometrial, absolutely not. We have never encountered any rejection. And the reason being is that most of these cells are, we tend to opt for autologous, which are self stem cells, okay, coming from the patient's own body. That is actually primarily our first choice, unless there's a really good reason why we would opt for another type of stem cell, depending on the condition, age, different factors. But because most of the stem cells are either autologous or they're an allogenic form, which is coming from another source, but they're non-immunogenic, which means there is no immune response. There's no immunogenic response by the body because they're non-immunogenic, which means that there's absolutely no immune response to endometrial stem cells, umbilical cord cells, or any other allogenic stem cell that we use at our clinic. So there's no reason or any type of rejection going on whatsoever, and there's no need for immunosuppression or immunosuppressive drugs. So it keeps it very clean and simple and without any complications for the patient.
I see. And can anyone be a candidate for stem cells, doctor? And this is like a two-part questions. And how do you conduct your screening?
Okay, so no, not everyone is a candidate for stem cell treatment. Uh, First of all, like we mentioned earlier in the podcast, a patient may, for instance, platelet lysate may be warranted versus stem cell treatment. In that case, we're very forthright with the patient, and we let them know that, look, you don't need to go through stem cell treatment to accomplish what we can do with, for instance, platelet lysate or another form of complementary or adjunctive treatment that we do at our clinic. Um, that being said, the criteria for screening a patient also to deduce candidacy can include age, the condition, the degree of debilitation, the prognosis. What are our chances of getting a positive result? If we know for a fact that, you as a patient are so far gone that we really don't see that you're going to see any improvement, we'll be very forthright and not have you go through the trouble of going through treatment if we know very well that there won't be a positive result. And then certain blood work. So we look for certain markers and other factors in the blood work to ensure that the patient is healthy enough to undergo a stem cell treatment.
Thank you, doctor. Um, you, I don't know if your patients usually are well informed about regenerative medicine or stem cells. When they come to you, are they already informed? Or do you recommend for them to investigate a little before they come?
That's an interesting question because most of the patients that do call us up, or prospective patients that call us up and requiring information and so on, most of them have done their homework. They'll look at other clinics. They will read up on stem cells and the prognosis for their condition. Prognosis being the results, the realistic outcomes is what a prognosis refers to when I say prognosis. So they will read up on the condition, they will read up on stem cells, they'll read up on different clinics or read about different clinics, perhaps contact other clinics. And I always uh, impose on these prospective patients to please do your homework. Please do your homework because it's really important to be well informed. It's really important that I do my job in informing and educating the patient. My job is not to convince you as a prospective patient. My job is to educate you in the most honest and forthright way possible with everything that I can present to you. And you go back and cross-check it, okay? In Latin, doctor means is the Latin word for doctor is docere. Docere means teacher. So that's how I see myself, as a teacher. And so I'm here to inform and not convince. And it's up to you to make the most informed decision and what's most comfortable for you as a patient.
I'm going to ask you one last question, doctor. Why did you decide to go with naturopathic medicine and regenerative medicine instead of going to
Allopathic
yeah.
medicine? I actually started out in pre-med. I was in my second year of university, pre-med, and going into the allogenic program. And I was to go into a little bit of a personal story, I was in a pretty severe traumatic car accident. And I remember at the time I was 19, and all the doctors wanted to throw at me were antidepressants for PTSD, post-traumatic stress disorder, painkillers, just a whole bunch of drugs that I tried one day of, and I was like a zombie. And I said to myself, no, there has to be a better way. And from then on, I started to look at natural medicine, complementary medicine, alternative medicine, regenerative medicine. And that's when I came across naturopathic medicine, complementary and alternative medicine. And from there on, I got into the path of stimulating the body to heal itself, whether it's through natural means outside of our body or from inside of our body, where stem cells and growth factors and other components play a role. And that's how I fell into this beautiful world of healing, which is so rewarding, and it's my passion. So I've become a healer, and I think that and that's really important as a physician, because of course, physicians and everyone has to make a living, but my goal in life is to heal as many people as I can, and so that's why we're here.
Okay, doctor, like I always ask you, is there anything else you would like to add to this podcast?
No, I think we covered a lot of ground. I'm very eager to hear back from our listeners and viewers for any other questions that they may have for us that we can address in our future podcasts of this series. And yes, so I really welcome any comments.
Okay, doctor, you have a wonderful day.
Thank you. You too, Luis.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.